Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam from Houston, Texas. Today, the focus of topic today is going to be hemorrhoids and constipation. They go hand in hand because one leads to the other. Let's talk about hemorrhoids. What are hemorrhoids? Hemorrhoids are basically dilated veins. Hemorrhoids are basically dilated veins inside the rectum and sometimes protruding outside the rectum. They may look like little bulges like a broccoli or a cauliflower. It is covered with skin, and these are basically dilated veins. And they can increase and decrease in size depending upon various factors. The hemorrhoids can be internal, and when you use like an anoscope and you look through that, you can see like a pedunculated little soft vascular mass, which as you can see, there's a ring that has been placed around that. We'll talk about that in the treatment plan. And that's how hemorrhoids, internal hemorrhoids look when you look through the anoscope. There are different techniques. You can do a physical, just visual inspection, or like an anoscope, which is a short scope looking into the anal cavity, or like a sigmoidoscope, which goes up to 18 inches to look for any evidence of pathology inside the rectum and the distal end of the colon. What causes hemorrhoid? As I said, these are just dilated veins. Anytime when we strain, there is pressure placed on these. Anytime we strain, there is pressure placed on these walls, which leads to dilatation of these veins, leading to the formation of hemorrhoids. And as a result of that, a repetitive, constant increase in pressure in the anal region can lead to hemorrhoids. Again, when we are straining during bowel movements, we are increasing the pressure that leads to the dilatation of the veins. And a few other causes, like sitting for long periods of time on the toilet, having chronic diarrhea and constipation, obesity can lead to increased incidence of hemorrhoids. Same thing with pregnancy. Because of the uterine pressure over the rectum, it can lead to the formation of, and of course, having an anal intercourse, and of course, low fiber diet, and heavy lifting. Heavy lifting, when you're doing heavy lifting, you're straining, and anything that increases the strain in the intra-abdominal cavity, that pressure is transferred to the organs, and that leads to the formation of these veins. And what kind of symptoms can we expect when you are having hemorrhoids? It can be painless, but sometimes you can feel a lump while you're washing your butt, and basically it's a pain in the butt. I mean, if you have hemorrhoids, it is really a pain in the butt. I tell you, it is painful. It hurts. Every step you take, it hurts. So the best thing is prevention, and we'll talk about prevention in a minute. You can have like a painless bleeding, or you can notice blood on your tissue paper. Feeling of discomfort in the rectum, a sensation of needing to defecate, pain in the rectum. And as I said, pain in the rectum or the butt, it's the same thing. Pain, sometimes itching, a feeling of fullness. And majority of the time, people have hemorrhoids and it doesn't bother, except they notice some occasional blood on the tissue paper. Some of the complications that can result from hemorrhoids include like blood loss. If you're losing blood on a consistent basis over a period of months and months, then it can lead to anemia. Sometimes these can get twisted and get strangulated, which can, like a strangulated appendix, it can give severe pain, and that's going to be a lot of agony. Same thing, there can be blood clot formation inside these veins. They are not dangerous, but they can be painful, and sometimes they can get infected. So these are some of the complications, and the worst of which is an inflamed hemorrhoid. Okay, what do you do when you have a minor case of an inflamed hemorrhoid or an irritated hemorrhoid? You can apply ice packs. You can apply like vitamin E or oil, gel. Sitz baths will help. Gently rubbing with Hazol or using a steroid cream or a preparation H. And the key is prevention and using high fiber diet and certain techniques which I will allude to towards the end of this presentation. Okay, there are certain things you want to avoid. I don't know why they say banana. They say banana is good for constipation, but however, it may not be good for hemorrhoids. Same thing using cold water or sitting for a long period on the toilet. On the other hand, buttermilk may helpful in facilitating bowel movements. Anyway, let's talk about prevention. I want to talk about prevention before treatment because this is what you and I can do. Because you're just seeing the doctor for half a day or you're seeing the doctor for once in 6 months or a year, but the rest of the time you're the one who is dealing with the pain in the butt. And you want to avoid the pain in the butt, here are some easy tips. Use high fiber diet. You need to get at least 30 grams of fiber. For example, I use psyllium, which is metamucil, 2 tablespoons, 1 tablespoon in the morning with 2 to 3 glasses of water. Hydration is important. Then I do the same thing in the evening. Make sure when you take fiber, you don't mix them with your pills. I used to mix my blood pressure pills with the metamucil. As a result, the blood pressure was never coming down. Then I realized, oh man, I shouldn't mix fiber with all the pills. So at least there should be 2 to 3 hours time difference between the time you take the fiber and your medications, because the fiber may interfere with the absorption of your medications. Drink plenty of fluids. I would say 10 to 12 glasses of water, but don't take my word for it, because if you have a heart problem, heart failure, or kidney failure, you shouldn't be drinking so much water. So that's why you need to follow up with your physician and see what is best for you. If you can handle water, hydration will keep the stools soft. As a result, it will reduce the strain on the commode. Consider fiber supplements, which I already talked to you. There are multiple fiber supplements available. Just walk through the grocery store, but watch when you are using fiber supplements, because some of them are sugar loaded. If you take 1 tablespoon of like metamucil with regular sugar, you're getting like 40 calories. And if you have diabetes, that's going to add to your sugar. So I would take a sugar-free supplement if you're having diabetes or if you're worried about obesity. And again, don't strain. And a lot of people say when they get the urge to go to the restroom, they say, oh, I'll do it tomorrow. Man, I can handle it. I can do it tomorrow. Then tomorrow comes, they say, oh man, I don't want to go there. Maybe I'll go next day. And guess what? 3 days your stools are sitting in your colon, and the longer it stays in the colon, the more water is absorbed from the stools, so it becomes hard like a rock. And you try to get that hard stools through the inflamed hemorrhoids. You get the picture. Anyway, so keep things calm and cool. And that is, keep the hydration. When you get the urge, you empty your colon. I mean, that's it. Because you don't want to be straining. You don't want to be having blood. You don't want to be having pain. And exercise. Regular exercise helps to increase motility of the gut. That increased motility will help to move the stools. And you can always keep the stools soft, because if you can't handle too much volume intake. And again, if you're sitting on this chair for a long period of time, sometimes you don't have a choice. When you're like a computer geek, you're sitting on the chair for 18, 20 hours, you're going to be, but you may want to take a break every hour or so, just walk around the office. Okay, there are a lot of laxatives available. Some of them are very strong, like Miralax is very, very powerful laxative, and also tastes ugly, I tell you. You can try it, but you can take Dulcolax or Surfax, any kind of over-the-counter stool softener. But when you do a combination of things, that is taking fiber, supplement. Number 2, keeping hydration well. Number 3, making sure you don't sit for 18 hours on the chair, hard chair. And number 4, use like foods that help to facilitate, like buttermilk. Then you can use a laxative if you need. But if you eat regular food with a lot of fiber, like salads, you have enough fiber, you have enough hydration, and you should be able to move your bowels easily. For minor inflammation or irritation, you can use preparation H, and if there is real swelling, you can try to reduce that by using hydrocortisone cream, but consult with your physician before you do any of these treatments, because you want to make sure you're not missing something more serious, like a strangulated hemorrhoid or a seriously inflamed hemorrhoid. Always consult with your physician. Okay, there are some surgical treatments that are available for management of hemorrhoids. One of them, the simpler one, is like putting a rubber band. But for that to be successful, you have to have a hemorrhoid that is sort of has a nice stalk, and then you hold this one and slowly slide this tube, and when this is close to the tip here, you release 1 or 2 of these rubber bands, and these rubber bands will slowly, over a period of time, choke this one, and that will result in a tiny scar without any kind of a suture needed. And that may work, and sometimes this may have to be repeated 3 to 4 times before you can really get rid of it. The next procedure is called the sclerotherapy, that is injecting a clotting material inside these veins. This is not the first place they have used it. They have been using this sclerosing agent to treat like fibroid of the uterus, where the fibroid is like a pedunculated structure. They cut off the blood supply by blocking the artery with the sclerosing agent, and the same technique is used to inject that clotting material inside these veins, and especially if you can do it at the bottom here, that will clot all these veins. It will shrink in size and eventually will because this is another example of putting the rubber bands. Now you see the rubber bands in place, and this may take several weeks for it to fall off, and this procedure may have to be repeated if it is not successful on the first attempt. But this is far better than doing surgery, and there are some surgical techniques which are kind of invasive and painful, but if everything else fails, they can put a ligature around here to prevent the veins from getting dilated here in the distal part of the colon and the rectum. Okay, ladies and gentlemen, this is a very quick overview of hemorrhoids and constipation. I think the best treatment is prevention. High fiber diet, plenty of fluids, fiber supplements, don't strain, don't sit on the commode for longer than 1 minute needed, do a regular exercise, and avoid prolonged sitting. So these are some of the tips. I am Dr. Nik Nikam, and this is Triple N Media, and please do subscribe to our YouTube channel. We have a lot of life lessons that helps you to live through your years without too much pain in the butt. Thank you so much.